All right, 11:10. Whew, almost made it. So this last piece of the puzzle we're gonna go through, we're gonna talk about brachial plexus at the beginning. And we'll do a little activity, and then I'll cover kind of some like upper extremity, lower extremity that I'd focus on. And then I'll go through all the G's essentially and tell you kind of high yield anatomy stuff I would focus on for the next couple weeks. One good question that was asked on the break is, are there orthostatic or not orthostatic? Are there ortho tests on Nplex 1? The answer is no. Nplex 1 will not have ortho tests. I know Wild Brilliance flashcards has some ortho tests on them. So if you're using them, you can ignore the ortho tests Wild Brilliance cards. Ortho tests are on Nplex 2. So can you diagnose orthopedic conditions or do ortho tests? That's on Nplex 2, not Nplex 1. Nplex 1 will test you about the AOIN, action, insertion, origin, innervation of muscles. So that could be on there. Bone structures, all those pieces, but not anything diagnostic. So no, they're not expecting you to know how to do orthostatic test, or not orthostatic testing, ortho testing, orthopedic testing. Okay, great, awesome. All right, so brachial plexus. If I was to know one thing in the upper extremity, I would start with the brachial plexus, and I'd go from there. Mainly because there's just so many good ways they can ask you questions. If you wanted a good mnemonic for just remembering that it goes roots, trunks, divisions, cords, and branches, read that damn cadaver book is my favorite. And it's actually represented on this little page. Teach Me Anatomy is a good website. It has a lot of like really easily understandable anatomical pages, web pages that go through and have really good pictures. They have another one on cranial nerves that's actually pretty good as well. So I do like pulling these up. They even have little quizzes. I'll remember to add this at the end of lecture, this link. So if you want that website, you can access it. But if we remember, all of the brachial plexus spinal nerves, they start from C5, 6, 7, 8, and T1. They're going to exit the spinal cord via the intervertebral foramina. And as they exit down, they're going to, like I said, form into trunks, then divisions, and cords, and then the branches. And the branches are what we often remember, given that those are the nerves that then innervate our muscles. It can get compressed by our scalene muscles, or really the muscles of our anterior kind of neck and upper thoracic region. And so patients who have more anxiety or are having to engage those upper respiratory muscles to breathe, you can see compression on the brachial plexus. Patients who have tight upper traps or upper SCM muscles can compress the brachial plexus, some of those nerve roots. And we can see radiculopathy, where we see numbness and tingling in certain dermatomal regions, which is, again, why this is such a great test question, or actual muscle weakness. We have superior, middle, and inferior trunks that we will see, and we're going to draw this out together, but superior is 5 and 6, middle is only 7, and inferior is 8 and T1. Our divisions are really just each of those trunks. They have a division that goes anterior and posterior, and then they're all going to combine together to make the cords. So just recognize that each trunk has an anterior and a posterior division. And then those anterior and posterior divisions of the trunks will come together to form specific cords, which will make more sense when we see it in color. The cords then are based off of their anatomical location, lateral, posterior, or medial, once the cords come together. And then you get your final branches at the end. And so we're essentially going to draw out kind of this picture. I have it a little bit more color coded than they do for ease of memory. But I want to talk about the end nerves just so we can see where they kind of go to. So our musculocutaneous nerve is a part of C5, 6, and 7. It's going to go into our brachialis, our biceps brachii, and our coracobrachialis muscles. And we can kind of see it follow its track here from C5, 6, and 7, and then see how it will combine together to form that final branch. Our axillary nerve is going to be our teres minor and deltoid muscles. And so we can kind of see here it's coming from C5 and 6 and moving down more posteriorly. Median nerve is probably the most cords. It's from C6 through T1. So it gets almost all of them except for C5, although even in some people, it'll contain some C5 as well. It's going to give most of the flexor muscles in the forearm, so letting us do this, and then the thenar muscles in our thumb, as well as 2 lateral lumbricals associated with the index and middle finger. Our radial nerve is going to be our triceps brachii, the muscles in the posterior compartment of the forearm. So remember anatomical position, so posterior compartment, so really extensor muscles. And then lastly, our ulnar nerve, which is going to be C8 and T1, which is going to be a lot of the muscles of our hand, except for the muscles of the thumb and the 2 lateral lumbricals. So it's going to be the flexor carpi ulnaris, as well as the medial half of the flexor digitorum profundus. So these are our major nerves of the upper extremity. I would start here. I would learn these, know where they innervate, and then you can try to learn the muscles. You can focus on those pieces of the puzzle, but knowing these nerves really helps you get through a lot of upper extremity questions on your Nplex 1 exam. So what we're going to look through here, we're going to just go through this, and then we're going to do a few other pieces with our, so I am doc camming for those of the people online. I will put back up your picture that we're going to kind of follow for the online folks. All right, so you're first going to want to make 4 folds in your paper, or 5 folds in your paper. So you want to have 5 compartments essentially. So make like an accordion with your paper. It's going to be the easiest, especially if you're not, so I guess it's 4 folds, 5 compartments, if you're not good at drawing straight lines like me. First time I did this, I tried to do fold it in half and fold it in half again. That only gives you 4 sections. So you have to fold it 4 times to give you 5 sections. An accordion. Let's go back and forth. Who knew it was going to be art class today? Good for your brain. 4 folds, 5 compartments. I make it like an accordion. Then once you have your 5 compartments, you're going to label the top, roots, trunks, divisions, cords, and branches. You'll label your 5 sections, roots, trunks, divisions, cords, and branches. Okay. Once we have our roots, we're going to put our 5 roots here. So cranial nerve 5, 6, 7, 8, and T1. 5 and 6, I have lines. They're going to connect together. So you can draw lines connecting them. C7 gets its own line because it's its own person, the individual. And then C8 and T1 get to be friends as well. So these are your roots. So 5 roots initially, and then this is showing kind of how they initially will combine. Once we've drawn our roots, we have our trunks. So our 5 roots, so C5 and C6 came together and they formed our superior trunk. C7 became the middle trunk, and C8 and T1 became our inferior trunk. Okay. We then have our divisions, and this is where a lot of people get confused, but I want you to just keep in mind The divisions will make sense once we get to our next step, our cords, okay? But there's the divisions, so I wouldn't even worry about the divisions yet until we get our cords. But the divisions, each trunk has an anterior and a posterior division. So if we look at the superior trunk, we can see there's an anterior and a posterior. The middle, there's an anterior and a posterior. The inferior, there's a posterior and an anterior. So what makes it easier is if you have the cords, so you can connect your divisions. So all three of the posterior cords or posterior divisions are going to come together to give you your posterior cord. So the posterior division from the superior, the posterior division from the middle, and the posterior division from the inferior join together to create your posterior cord. So if there's something posterior, it's going to continue to be posterior. That's why our posterior cord is going to actually be collecting from all of our cranial nerve divisions, which will make sense once we see its final process. Okay. Our lateral cord, the outside, is going to connect the two anterior cords or two anterior divisions from the superior and the middle trunk. So superior and middle trunk had anterior divisions and they create the lateral cord. So the lateral cord is a combination of C5, 6, and 7. Our medial cord gets the anterior division from just the inferior trunk. So we see it only has one little sad, lonely line, kind of like C7 at the beginning, right? So our medial cord is only from C8 and T1. Okay, so far so good. Now we get to our final branches. So from our lateral branch, the easy one is out straight. It's going to be your musculocutaneous. And I ran out of space. So that's why I said musculocutaneous, but it's cutaneous. That's your musculocutaneous branch, comes off of the lateral on its own. We're going to not do the green yet. We're going to go all the way down to the bottom to our medial cord. On its own, like the musculocutaneous, we have the ulnar. The ulnar is just from the medial cord. We have our ulnar branch. From our posterior cord, we have two branches. The posterior cord branches into the axillary and the radial from the posterior cord. So axillary, one branch, radial, the other branch. And the only branch that combines more than one cord is the median nerve, this green one. It takes essentially a portion of the lateral cord and a portion of the medial cord, and it combines together to make the median nerve, which makes sense. The median nerve is running relatively median, so it's going to take part of the lateral and part of the medial and combine together into one. So those are your branches. How can this be used in questions, test questions? Oftentimes, they'll want you to know what these innervate. So knowing the muscles that they innervate or the spaces or compartments, that's helpful. Because often the question will be, your patient is unable to do this type of a motion, or there's a damage to this type of a muscle. What nerve is involved? Or vice versa. There's a damage to a cranial nerve root. They'll typically ask all the way up here, what nerve, or more likely, what structures are involved? And then they'll give you a list. That's the most common, probably upper extremity MSK question you'll get related to anatomy. Okay. That'd be probably your most high yield from upper extremity. Any other questions about this? Yes. Yes, the radial is its own little branch from the posterior cord. I just couldn't, that's why it's a different color. I just couldn't draw it without having to put it in there. Yep, so you could pretend the green's going beneath it. My expertise in drawing. Yeah. Okay. So with that being said, I'm going to leave this up for a second longer. So the two PowerPoints that are upper extremity and lower extremity, they have all of your action, innervation, origin, and insertion for your major muscles of the upper and lower extremities. So what I would go through for those is I would look at their innervations and make groupings of the muscles that are innervated. If we had more time, that's what we would do at the end of the day today, but I'm not going to make you go through the activity here. But that's how I would spend your time for MSK anatomy, is I would go through and find the nerves and group based off of the nerve what muscles are innervated by that nerve, because that's really easy pickings for test questions. Because then you have muscles, nerves, categories. You can have neurologic and MSK questions that can come from that. After you know those, if you have time to commit more specific actions to memory, great. Generalized actions you probably should be able to understand based off where the muscle is. But if you don't know any of the actions of the muscles involved, that would be important as well. I would not study origin or insertion at this point. So if you know action and innervation of the major muscles of the upper and lower extremity, I would call that good for those sections. If you want something else, if you're like, no, I need more MSK, sure, go into vasculature. That's fine. Specifically arteries, but I would say that's lower yield than the vasculature we've already covered today. There will be some questions on it, maybe one, maybe two, but less than the other areas of vasculature that we discussed. So for your MSK anatomy, that's what I'd focus on. I'd really focus on upper lower extremity, nerves, actions, and then probably call that good for that section. So you're about 2.5 weeks-ish, a little bit more out. Okay, great. When it comes to, let's do this. Let me get off the doc cam. Sorry. I'll keep my pictures up. I think I told people I'd record videos, so I'll record a video of my drawings of me doing them. I'm sorry. Don't watch them if you've already seen them. Okay, so that was MSK. So this is the 2022 study guide. So it's 1 year old. I was unable to post the 2023 one by habit. Woo. All right, it's $5, but I mean, it's also a PDF. Do with that as you may. So join in, it'll be like 1 penny each. Okay, so on that note, so what I wanted to do is just go through these systems and talk about what anatomically we should focus on for the next 2.5 weeks. So MSK we talked about, innervations of the upper and lower extremities, brachial plexus, and actions of those muscles. I wouldn't necessarily, go crazy over even muscles and bones in other areas at this point. There's muscles in your face, there's muscles in your neck, there's muscles in your abdomen. I would learn the upper and lower extremity ones first of MSK and then feel good there if that's all you can get to for the next 2 weeks. For cardiovascular, for anatomy, we're talking just anatomy, I would again focus on the arch of the aorta and the coronary blood flow. Those would be the 2 areas that I would focus on for cardiovascular anatomy. I wouldn't really worry about anything else. For gastrointestinal system, obviously, I hope you know the direction food would go, right? As we eat something down, that I expect you to have as prior knowledge, like mouth, esophagus, et cetera, et cetera. I would say abdominal aorta branches for vasculature would be high yield, as well as the bile, hepatic tubes, ampulla, pancreas, that structure that we talked about today. Ampulla, vater, accessory and main pancreatic duct, cystic and bile duct, that region would be higher yield for anatomy. So those 2 pieces. Okay. Neuro, circle of Willis for vasculature. Understanding in general, like one specific thing about each of the structures. So thalamus, sensory integration, hypothalamus, autonomic nervous system integration, your brainstem regions, like your medulla, medullary oblongata, it's like everything, right? So know one specific thing about each major region of the brain. I think that's a good place to be for your anatomy, for your CNS. And if you can add one additional piece in there, I would put in the cerebrospinal fluid flow. I'm purposely not talking about spinal cord anatomy because we're going to cover that in physiology. And I feel like learning, like memorizing it is not helpful, but learning how it applies to action potential and circulation and stimulation, that will make more sense. So I wouldn't think of that as an anatomy study piece. Try to go through the high yield systems first. Repro anatomy, we didn't talk a ton about this. I would focus honestly on male reproductive anatomy more than female reproductive anatomy. There tends to be more questions on male reproductive anatomy. This is lower, these are lower yield than the first sections I already mentioned. So I'd focus on neuro, gastro, cardio, and MSK first for anatomy. And then if you're doing some repro, understanding the structures that flow through the inguinal canal, the relationship between vas deferens, seminiferous tubule, those type of things. That would be more helpful. For female anatomy, you could think about the different ligaments, round ligament, ovarian ligament, those often come up. Okay. Urinary system, your real only anatomy questions will probably come from the kidney. So again, we're going to look at the internal structure of the kidney when we look at kidney physiology. So I would just, you can kind of not, there's really gross anatomical structure besides like height of kidney for spinal column. They're really going to focus more on your micro anatomy structure of the kidney and the nephron. Respiratory system, your bronchial tubes, maybe if you really want to, that'd be fine. You're branching. Your alveoli and maybe some microanatomy would be more interesting there, but it kind of again gets into physiology. So I think you'll feel more confident once we do the physio of palm. What else? Endocrine system, pituitary gland. That's really what I focus on. Pituitary gland first, adrenal gland second. We will recover, those are the two things we cover too in the endocrine physio review, but pituitary and adrenal gland, those anatomy structures, that would be what I'd focus on. Immunologic, when it comes to the immune system for anatomy, it'd really be lymph nodes or spleen, maybe a thymus question here. It's going to be more low yield. So if you wanted to skip a section for anatomy, maybe skip it. I guess the one piece would just be remember the thoracic duct. That's your big drainer. And you could, if you wanted to, just remember also 9 to 12. That's the area that does not drain to the thoracic duct. So you could review that section of drainage for lymphatics. And then your last two, your low yield systems, integumentary for anatomy. Structure, I mean, your layers of skin, review those, your epidermal layers to your dermal layers, that would be fine. Really more where the cell types are. So this is where you could get into a little more histology. What layer has melanocytes? What layer would your glands come from? What layer is vascular versus what layer is innervated versus avascular versus vascular? That would be fine. Again, though, 6% of your test is integumentary. So that's, you're talking maybe one question. And then hematopoietic, do maybe a run through the bone, like a long bone with bone marrow. That's where your actual development of those cells would be. I think that'd probably be the most high yield because you could think about the physio of that, which would be hematopoiesis. So it's almost getting into more physiology though. So that's where I would focus my attention there. That's your anatomy review. Remember, about almost half of anatomy may be embryology that's combined in anatomy. So that's that germ stuff we talked about yesterday. And then I would focus on gastro, cardio, and neuro and MSK. Those would be the areas I'd focus on. Okay. We have a little bit of time for anyone if there's questions. So if there's any questions, feel free to ask. If you want to stick around and ask a question off mic, I'm happy to do so. But otherwise, we'll probably end here officially. And then tomorrow we're going to start physiology. We'll do that this week and next week. Okay, thanks. Go team. Did it. There'll be about an hour tomorrow. If you have questions or certain areas you want to cover, there's some flex. I have content that we could cover the whole time, whole 4 hours. But if there's certain things you want to focus on, I have like an hour kind of built in of flex time. So feel free to email me or let me know that morning and we can find something to go through for the area you need. Please do. Yes, absolutely. Yeah. Hi.
Question about the duodenal intraperitoneal retroperitoneal
Yes.
thing. So in the notes it said something along like the first one was intraperitoneal and then by fourth, then it said it goes from retroperitoneal to intra, so like
So it's twisting around.
okay.
So it is going intra,
So
retro, and
it
then
goes,
back
like,
out.
Intra is 1, and then like, what, 2 through?
2 through 4 would be going retroperitoneal, and then it's gonna come back out up front.
Okay.
Intra for 5, and then that's when it converts or moves into the jejunum.
Okay. Cool.
Yeah.
Okay, just one.
Yes,
Thank
of
you.
course, yeah. Please do, yeah. You see some stuff in the chat. Awesome. Thank y'all. I'll work on posting the recordings too. And again, this goes to you online, folks. If there's anything you want me to focus on for physio, we'll be doing physio tomorrow and a little bit into next week. So send me an email or feel free to bring it up tomorrow on the chat if you're here electronically. I'm going to stop the recording now and I'm going to end the Zoom session. So thanks. When will I post this video? Good question, Rhea. I have to download them and upload. It takes about an hour to upload to YouTube. So tonight, when I'm off clinic at 7, I will start uploading them. So probably sometime late tonight. So by tomorrow. Of course. Thanks, Cynthia.